Women sometimes need to have emergency hormonal contraception because they've had an episode of unprotected sexual intercourse and they're not planning to have a pregnancy. It's really important for them to know how to access emergency contraception. What do you do at Brooke surgery?
We had a request this morning actually. A patient put a request in about 3 a.m. and they had intercourse with their partner and the condom split. And they were worried that they could become pregnant. So what we did was we spoke to the patient, we assessed them according to their medical records and offer them 2 options. The first option was hormonal treatment, which is something that we can send to their local chemist so they can pick it up with ease. And the second thing was to offer them the other option, which is the coil, as you mentioned. However, the wait times for a coil often are quite long. The patient did choose the first option and we sent them the prescription to their chemist and they were very satisfied with that service.
Well, that's really good to hear because ultimately it's patient choice. And what is really important if you are having the oral emergency hormonal contraception is to try and have it as soon as possible because the quicker you take it, the more effective it is. But also to remember, it actually only covers you for that episode of unprotected sexual intercourse. So if there's a risk of pregnancy, then you will need to use protection, usually in the form of condoms, for the remainder of your cycle.
If, like the patient I mentioned, you want 24/7 access to emergency contraception, you're more than welcome to sign up and switch to the Brooke surgery, and we'll be happy to help.